pandemic has had tough consequences. Families across the UK and in my constituency have had to make hard choices and sacrifices in order to protect the health of the nation. This global health crisis has shone a light onto the fundamental building blocks of our society. It has forced us to question what really matters, how our social structures operate, and who are the organisations, the people and the community we look to for support in our daily lives. This pandemic has shown that not always can or should the answer lie in the hands of government. Instead, the value of a rich and meaningful family, community and local support network has been realised. In July this year, I welcomed the government's support for a place-based approach to supporting education and employment outcomes as part of the country's recovery measures from the pandemic. In my constituency of Stoke-on-Trent Central, I was delighted to see the government deliver an extra £1.67 million in funding through the Opportunity Areas programme, which included support for holiday clubs for children and families, such as A Up Duck. The A Up Duck Club and many charity organisations in Stoke throughout the pandemic have shown the value of voluntary and community sector organisations in supporting the delivery of government-funded programmes for children and families, in particular for the role they played in ensuring that government-funded meals were delivered to children on low-income households throughout the months of the school holidays and school closures. Since 2018, A Up Duck have delivered over 26,000 meals to more than 18,000 children and young people in schools, community centres and sports clubs across Stoke-on-Trent. This is a fantastic example of how charities are an essential community resource in organising the delivery of government funding tailored to specific needs in the community. Age UK has conducted some research which shows that we feel more connected to our friends, our families and our communities. We are much less likely to encounter problems with brain function in later life. And so it's really important that coming out of this pandemic, we capitalise on public support for volunteering and working together in families to continue to see ways of harnessing and continuing the economic, social and health benefits of being more connected with our community. To conclude, time and time again, it is through empowering families, communities and charitable organisations with the financial and political power to act, which has proven to be the most effective and the most effective way of targeting government money at those who need it most.
Thank you.